Today I'm covering the 3 mistakes when teaching pronouns to children with autism and/or speech delays, and what to do instead, how to teach these pronouns if they need to be taught. So let's get to this really important episode about pronouns. Hi there, I'm Dr. Mary Barbera, the host of the Autism and Speech Delays Made Easy podcast, and today we're covering how to teach pronouns, what to do if you get pronoun reversals, what to do if your child remains non-speaking, non-verbal, and you want to improve skills like turn taking. So first, a question: is your child or client saying things like pick you up or hang up your backpack as they're hanging up their own backpack, or you want a cookie when they want a cookie? So they should be saying I want a cookie as they're reaching for a cookie. So these are called pronoun reversals and are common in young children with autism and or severe language delays. Most kids pick up pronouns and other parts of speech very naturally. And while you might have a hiccup or two with some pronoun reversals, it's days until the child straightens their language out and it doesn't seem like there's any problem. But when you have a child who's significantly delayed and needs to learn pronouns, sometimes parents and professionals can make these 3 mistakes I'm going to be talking about today when teaching pronouns. And I do want to say that this is all from my perspective, and you might have a situation where maybe this isn't a mistake. I'm just saying these are the things I've seen as a board certified behavior analyst working in the early intervention classrooms, in early intervention preschool classrooms, in autism classrooms throughout the state of Pennsylvania, working with thousands of kids directly, and then doing online training for millions of parents and professionals from over 100 countries. So mistake number 1 is trying to teach pronouns too early. We want to avoid this. And you might be thinking, well, we're not teaching pronouns. Like, there's no problem. But teaching my and your in terms of turn taking is very, very common, even with kids that aren't speaking. Modeling language, I want a cookie, or do you want a cookie? You're not teaching it, but it can be picked up incorrectly. So when we're trying to teach too early, which is mistake number 1, we might end up confusing the matter even more so. Using pronouns correctly is actually a higher verbal skill than most people think. For behavior analysts out there, and for those using applied behavior analysis, verbal behavior type programs, those of you using the VB map by Dr. Mark Sundberg, using pronouns in terms of expressively using pronouns and receptively identifying pronouns is actually a 30 to 48 month old skill. It doesn't come until you have a decent amount of vocabulary under your belt. So you might think, well, my child's already 3 or 4, so they're good. But if they are 3 or 4 chronologically, but they are not speaking, then they're falling into the level 1 BB map, which is 0 to 18-month-old skills. So you can't pile on 30-month-old skills when the child hasn't mastered those earlier skills. Even if your child's real age is 3 and they're functioning at a 2-year-old level or a 12-month-old level, we need to be careful about not teaching things like pronouns and prepositions and colors and all kinds of things that it's going to be better. The more natural your child can pick up language, the better he or she will do in the long run, because if we have to teach every single critical skill, It's going to take a long time, and we're probably going to do things a little bit out of order, and we may end up not helping the situation. I believe that children need to be using hundreds of words functionally and combining words spontaneously before we can or should work on pronouns. And when I say spontaneously putting words together, I want, which is a carrier phrase, which I've done a lot of work on. We can link a blog in the show notes about why I don't like those I want, it's a, I see kind of carrier phrases. They don't count as spontaneously putting words together. So children should be putting words together like mommy car or kickball or red candy or, those kind of things where you're putting together a noun and an action, a noun and an adjective or adverb. We need to help children begin, first of all, just put nouns together and not introduce pronouns until they have some solid vocabulary. So on to mistake number 2, which I kind of alluded to, is mistake number 2 is starting turn-taking pronouns, my turn, your turn. I don't like to start with my turn, your turn, although it is one of the most common goals I've seen on an IFSP, which is a plan for kids 0 to 3, or an IEP for kids older than 3, especially for kids with little to no language. And I don't think my turn, your turn is a good goal for any child that isn't, like I said, speaking, putting words together, understanding words, touching body parts, identifying functional items, saying mommy car. Even if they're not doing the plurals like mommy's car, that's fine. They need to be putting, Lucas's drink or Lucas drink or versus mommy drink before we can say my and your and I and you, and it gets really complicated. So specifically on turn taking and teaching pronouns during turn taking, the language is too high and complicated, and the whole idea of waiting for a turn, sitting, attending, and following any kind of simple rules of the game is way too much for these little children who are functioning below a 30-month-old level. It just is too much. And our final mistake number 3, is starting teaching receptive pronouns, which is common. Usually if I'm going to start teaching body parts, for instance, especially for a child with little to no language, I can help them touch their head versus their belly. It doesn't require any vocal speech, versus what's this called as I point to my head versus my belly, and that would be a tact or expressive label of a body part. So we usually do start with receptive, and then we move to tact, or we use some kind of transfer procedure to teach that. But with pronouns, if you teach the receptive pronoun first, it actually gets more confusing. So if I say, roll the ball to me, and then if I say, who are you rolling the ball to? The answer is not me, it's you. So you can see how that gets really messed up. If you say, do you want a cookie? And the child echoes, you want a cookie, which is common, and you give it to them, then now you've shaped up a pronoun reversal very inadvertently. And the less we have to clean up pronoun reversals or worry about what I should say, what I shouldn't say, what I should reinforce, what I shouldn't reinforce, the best thing to do is to not start with receptive pronouns. I'm going to show you what I would start with instead. Now, I do want to caution you that most of the articles on the internet, like one by speech and language kids.com, they have 5 steps to teach he and she, and they suggest first teaching children receptive, and we can link that in the show notes. And they have the contradictory advice. They believe in teaching pronouns receptively first. I disagree. I think there's a certain order when it goes better for kids who are ready to learn pronouns. So one of the main reasons I don't teach receptive first is because you cannot use a receptive to tact transfer when teaching pronouns. It just doesn't work. If I say touch my arm and the child touches my arm, and then I say, right, whose arm? And he says, my arm, that would be incorrect. So here is how, and I've done a lot of work with transfer procedures, and if you're using applied behavior analysis, verbal behavior, and you don't know fluently what a transfer trial is, you're not using it every single day of your life, or you're a parent out there and your child is having lots of errors and you don't know what transfer trials are, we can link some of the blogs or podcasts that I've done on transfer procedures in the show notes as well. So now let's get to how I would recommend and how I've taught pronouns. First of all, if your child's not ready to learn pronouns because they don't have hundreds of mans and tacts and the child's not combining words spontaneously, we want to eliminate pronouns from the directions we give, especially if the child is echoing. So instead of saying roll the ball to me, I'm going to eliminate the pronoun by just saying roll ball. And then if they echo roll ball, we're all good. And now if they echo or they spontaneously say roll ball, I can roll it to them. Hang up your backpack. We want to get rid of the your and just say hang up backpack. Brush hair instead of brush your hair. You get the idea. So if a child is not at the 30-month age level for expressive language or receptive language, we want to eliminate those pronouns. And also allow the child and encourage the child to teach names of people like mommy, daddy, Susie, Annie, Tommy, and then encourage them to say, instead of my turn, Lucas's turn, or Drew's turn, or Annie's turn, versus mommy's turn. We'll eventually get to pronouns, but the first step, if you think about like a 2-year-old just starting to talk, they're going to say things like mommy's turn and dad's nose. And that's fine. That's where we want to leave pronouns until a child is truly ready with the prerequisites. We also want to reduce syllables and word utterances when talking to your child with lower language abilities. Now, when your child is ready to learn pronouns, here's what I would do. Remember, teaching pronouns is tricky. I equate it to, it could be a bad game of who's on first. If you aren't fluent with how to teach it. In my online course and community, and I'm going to be starting very, very soon, a professional all access membership. And in one of the videos, I truly show the importance of getting very fluent with these procedures, because it is tricky to teach intermediate learners at the BB-MAP level 2 and 3 these kind of language skills. So first, have 3 to 5 reinforcements ready. You can use bite-sized edibles, bubbles, a clicker, bears and cup, and things that I talk about in other videos. And I would recommend you teach I do, you do as a tact first. I do, you do. And we want to do that with objects. So if you have a cup, we want to teach I do, you do with items or objects. So I have a cup here we're just going to use a cup. You could use bubbles. You could use any kind of item that the child can hold. Now, if the child's real little, I'm not going to use a big cup like this because we're going to want to fluently pass it back and forth. So, first of all, I'm holding the cup, for those of you listening. And now I have the child sitting across from me. They're very, they like table time. So that's like a whole different thing. We're going to do trials of this. We're not just going to once every couple hours mention a pronoun. We're going to actually do a little program where they're going to get some I do's, they're going to get some you do's, they're going to be mixed and varied. So I'm holding the cup and I say to the child who's sitting catty corner from me at a table, who has the cup? Now, right away, I'm going to have to prompt what I want to come out of their mouth. So, who has the cup? You do. And the child will echo, you do. Now we do a transfer trial. Right. Who has the cup? And you could take their little hand and point it towards you and give a partial prompt if needed with you do. Right. Who has the cup? You do. Then you give the cup to the child. Now who has the cup? And I like to take the child's hand if possible and point their own hand to their own chest and prompt, I do. Right. Who has the cup? I do. So when you do a transfer trial, you do a less of a prompt, but the child's got to get it right. So if the child's not echoing, the child's not responding correctly, the child's erring on the transfer, it's probably too early or you might not be doing it exactly correctly. Now, you're going to want to mix some other skills in. Maybe you want to blow some bubbles at this point. It doesn't have to be the cup every time. So you blow some bubbles as reinforcement. And now, who has the bubbles? You do. You do. Who has the bubbles? You do. And so we want to use transfer trials to teach I do, you do. I highly recommend that you role play this I do, you do with a typical adult or a typical older child before you try to teach a child with autism or severe language delays. Because the last thing you want to do is dig a hole and make their language even harder to understand or more messy. Remember, you have to provide a 0-second prompt or an errorless prompt immediately with the correct answer. I do like to pause a little bit. Who has the cup? I do. Or who has the cup? You do. So that it's not who has the cup? You do. The child won't know what to echo. But you do want to prevent the error with an errorless prompt. And remember, you're always, when you're prompting, looking at what should be coming out of the child's mouth or their perspective. And then I, like I said, like to use a gentle physical prompt to help the child understand when they're pointing to me and they're saying you, when they're pointing or tapping their own chest, saying I in terms of I do, you do. I find that starting with I do, you do is the best place to start teaching pronouns, the expressive or tacting of pronouns. Make sure you're sitting close enough to the child where you can easily reach their arm and hand and make it playful, make it fun. If they have any avoidance to table time, you need to back way up, attend a free workshop, join our online course and community. There is no prompting a child that is not interested in sitting and learning and attending and having fun. You can also use partial prompts where you say you instead of you do. You can just give a partial prompt, but whenever you give a prompt, you should transfer it to get less of a prompt. And you're only teaching the tact or expressive version of the pronoun. Now, the second set of pronouns that you can teach, and sometimes I can teach it both at the same time with I do, you do, or I have to wait till that's mastered and then I can teach my and your. But we're not teaching my and your in terms of turn taking because that's extra complicated with the rules and the sitting and the language, and it's just more confusing. So I like to do it with body parts or clothing. So again, I'm sitting catty corner. I've got my reinforcement. The child is happy. We're going to work on a couple of, we're not going to drill the child for 5 minutes on my versus your, or I do, you do. But we're going to have to do some trials in order to get enough exemplars of each. You also don't want to go always you do first, always I do second, always the same items. That will become rote and the child will be guessing what they should say instead of me. So sometimes you want to do a few times of my or a few times of I do in a row so that the child's not trying to predict what the answer should be. So for my and your, again, we're going to use body parts or clothing. And we're going to say whose head as you touch their head or your own head. So I'm touching my own head. Whose head? And now I'm going to say your head, your head. Good. Whose head as I'm touching my own head. And they're going to say your head because they just heard it. We just did a transfer. And then we could do the same thing with head, or we can go to whose shirt, your shirt, and we don't want them to just say my or your. We want them to say the two words, my shirt, my head, your head. So for my and your, again, we're going to use body parts and clothing. We're going to teach the my and your as attacked, as labeling, not receptively. We're going to say whose, blank, shirt, nose, etc. And we're going to correct any pronoun reversals in the natural environment as we go to, or eliminate them in the natural environment as much as possible, because every time we're error correcting, they're making mistakes, we could be digging a big hole. And we do need to do some intensive teaching and build fluency on pronouns before we can get to more generalized things like turn taking. So once I do and you do and my and your are mastered, fluent and generalized, you can consider teaching turn taking with my turn, your turn, with two people playing a game. Consider some intensive teaching and building fluency with I do, you do, and my and your before we move on to generalizing skills in the natural environment, and also before we begin turn taking and teaching my turn and your turn within the context of a game or activity, which is an important skill, but we have probably some work to do before we get there. So in summary, teaching pronouns is super tricky. So don't start too early. Avoid starting with my turn, your turn, and also teach expressive pronouns, tacting of pronouns of I do, you do, and my and your before we get into any receptive pronouns. I hope that was helpful. If it was, I would love if you would share this video with someone that would benefit. Leave a rating and review. That really helps us spread the word. And if you have more questions about pronouns or an idea for a new podcast, let us know. Contact us through our website, marybarbera.com. I would love to see a screenshot of your review of anything we've done. I would love to hear your thoughts on the podcast, ways we can improve, and new topics that would be helpful for you and other parents and professionals around the world. Thanks so much and have a great one. See you here next time, same place.